Get into that conversation that I mentioned earlier on. Kenya Association of Manufacturers Automotive Sector has developed ventilators that will be used in the fight against COVID-19. Those ventilators have been approved by KEBS already. Now, joining me is the CEO for Kenya Association of Manufacturers, Phyllis Wakiaga. Thanks for making time for us, Madam Phyllis. So where did we get the raw materials for the assembly of these ventilators? Should any one of them break down? Do we have enough spare parts?
Good morning, Trevor. Nice talking to you today. So it's an exciting season, I think, despite the pandemic that we are trying to deal with as a country. And as we know, this has really been disruptive to our day-to-day lives and our activities. On the other hand, we've also seen a lot of innovation come out of industry. And one of the things that we've been working on for the last almost 1 month now has been the development of a local ventilator. Our automotive sector members, some of them came together and started working on the development of a local ventilator to be able to save lives. Of course, the first thing we would be trying to do is to prevent the spread of COVID within the country. But in the event that there is need for ventilators, the sector thought that was important for us to develop a local ventilator. So that's what we did. And this ventilator has gone through a number of stages. There are still stages that we need to go through even with KEBS. They've looked at it, given input, and in the next maybe 5 days, we'll get back to them incorporating the final input that we've received and hopefully be able to go into mass production. So that's the state of the work we've been doing around the ventilator. The ambition is to see if this can be used in the local market, if there is need, and also for exports into the region. And that's really what we want to see, that we contribute and participate in saving the lives of our citizens in Kenya and around the globe.
What would it take for it to be exported, Phyllis?
First of all, just to mention, I remember you asked about the materials that we used. 75% of the materials that have been used in the ventilator are actually locally available materials. What the sector tried to do is to ensure that we use as much of what is locally available, because as you said, there's a serious global demand for ventilators and also the raw materials that go into it. So we've only imported 25% of the materials which are not locally available. So that means in terms of the global supply chain and the availability of what you need to manufacture the ventilator, we'll be able to get a lot of it locally. And what they're importing is material that is not necessarily going to run out of stock from the global market. So that's something that will ensure that we can produce to scale. Then in terms of exporting, once it's fully approved by KEBS and the standards, the permit is issued to start production, they can then go into mass production and market the ventilator around the continent. So probably work with KEBS to work with the Bureau of Standards within the region also, so that the common standard is then adopted for the ability to export into the region.
So what's our manufacturing speed, Phyllis? Should it go to full-blown export? How many can we actually manufacture in how many hours or days?
The sector is approximating that they can do 500 a week when they're up to full production. So of course, this was the stage of prototyping, and once we get into the mass production, they are estimating that they could actually do about 500 ventilators a week.
Okay. And what is the roadmap? Do we have a plan of ensuring that first the hospitals here get what they need and before we export? What is the plan for this, the long-term plan?
I think the long-term plan, as I said, the first course of action in a pandemic like this is to try and mitigate, prevent the spread, and try and contain it as much as possible, so that the need for ventilators becomes a last option once we've tried to contain the disease. At the point that we need the ventilators, then the Ministry of Health would then have to give guidance on how many they would require locally, both at the national level and county level. And based on the need, then they'd be able to supply. They've also worked on having a maintenance plan, training also, developing YouTube videos that can be used to train, having the manuals, so that it's easy to scale up and get a number of the critical care providers to use it.
So what cost are we looking at? How much is a ventilator? Especially the Pumua Ishi 2.0 one.
The Pumua Ishi 2.0 is approximated to be about 500,000 Kenyan shillings. The market price of a ventilator is normally about 2 million from what they've looked at in terms of the market. So they're looking at producing this at about 500,000 within the country.
So if it's 500,000 and then maybe a markup for a bit of profit, we're looking at what, 1 million?
Yeah, I think indicatively it will be below 1 million for sure.
Below 1 million. Okay.
Yeah.
So are we going to ensure that the hospitals here first can afford them? Because we are wondering, did it have to take a pandemic for us to realize the potential of our local industries?
I believe, Trevor, the local industries have been innovative. The thing is, in this season also, a crisis like this is something that really drives people to also dig deeply into their creativity. I think Kenya Association of Manufacturers are not the only ones who've tried to do this. You've seen a number of people trying to do the ventilators. We are not only working on ventilators, the sector has also moved into hygiene products, expanded their lines in this area. You've also seen that the sector is now producing masks locally. They are doing surgical masks. There are people even now speaking about setting up plants locally, hopefully to even eventually do N95s over a period of time. We've also seen the factories do protective gear locally. And a lot of these companies have actually been doing this for export markets. So it means that that potential has been in the country. And what has created maybe the momentum now is the deep need, the support from government also, because of the serious support we're getting from the Ministry of Industry to try and help us to navigate, to innovate. I think that has really gone a long way, and we really must commend the CS for Industry, Betty Maina, for the role she's playing to catalyze local industry during this period.
Yeah, Phyllis, where's the synergy? Because I see many other institutions are also trying to make the ventilators at the same time. Are you going to have a concerted effort, or is it every man for himself and God for us all?
I think, Trevor, let's just start by saying, as I told you, it's the automobile sector. So different people actually came and worked together. The team that worked on this was 5 different people from 5 different places. So I think already there's synergy and collaboration, because Ashit is the chair of our automobile sector at KAM, and the team was comprised of 5 different people from different organizations.
Yeah.
So I think already there we see the synergy. The ventilator even has a backup battery for 4 hours, and chloride oxide was the one that produced and gave the battery to us. So I think we see a lot of collaboration in this area. And as we move forward, the different components, if we go to scale, these different components can even be subcontracted for different players to make them, the way you see in in countries where companies are manufacturing products to scale. So this is something I think that could lead to a lot of local collaborations, and also bring in SMEs to make part of the components that are required to manufacture, as long as we get to scale. Yeah.
You've actually just preempted my question, because I was about to ask you, how are you ensuring that this, when it goes to the local places, that people can even use them? Because we have instances where medical equipment are lying, gathering dust because there's no personnel that have the knowledge of using them, and also maybe the infrastructure doesn't allow. Maybe there's no power there, so is there a solar system for the Pumua Ishi 2.0?
Yes, you're right about the issue of capacity. And that's why, as part of this, there'll be a whole training of the different personnel who will be utilizing these ventilators. Our healthcare system, I think, has really been challenged by what is happening with COVID, and we are going to see, hopefully going forward, a lot of support for the healthcare sector. But ensuring that having, the battery, a backup battery, is really looking and taking into account the unique circumstances that we have as a country, that sometimes we do have power blackouts. So that 4-hour backup would be able to deal with that. But there's still critical need to ensure that we have oxygen supplied to the different hospitals, ensure that the piping is in place, and really put in place the right healthcare infrastructure, not just for COVID, but really even post-COVID. We need to ensure that our healthcare is able to support the lives of the citizens of this country.
So you're saying the Pumua Ishi 2.0 is both AC and DC, right?
Yes, it uses battery, and it also can connect directly to power.
How long is the backup battery? 4 hours, you say?
It's a 4-hour backup battery.
Okay, so what are some of the gaps that you've seen in terms of the manufacturing industry? What more needs to be done to sort of entice them into going full-blown? Because at this rate, it seems then we can be self-sufficient or self-reliant.
That's true. One of the things we've spoken about over years is the issue of buy Kenya, build Kenya. Because the only reason people are now really doing a lot of these products, whether it's trying to manufacture ventilators, doing the protective gear, getting into the gumboots and the masks and all the hygiene products and everything you've seen, is because there's a market. And government is saying we will buy from the local industry. And you know government is really the largest buyer of goods and services. Unfortunately, also the disruption in the global supply chain and the fact that those goods are not available has made us look internally as a country. So this should not only happen during a pandemic, but really if we were supporting and buying from local industry, that would go a long way. The second thing is creating a very facilitative environment that allows for speed for innovations to be supported. Because in terms of approvals, getting the support from the relevant bodies, we really must say that at this time, we've really received a lot of that support. If this can continue into the future, I believe we'll see a lot more manufacturers expand and go into new areas. We've also typically, as a region or as a big player or a leader in manufacturing in the region, been trying to say that we need to get into new areas of manufacturing. There are a lot of opportunities for import substitution for many products. So a very deliberate strategy to ensure that we are able to manufacture very competitively within the country will support that import substitution strategy. And out of this, if we can also really implement our national export strategy, we'll not only be manufacturing for Kenya, but even taking advantage of the Africa Continental Free Trade Agreement so that we use Kenya as a manufacturing base for the rest of Africa. So that support from government, ensuring that we have a competitive business environment, ensuring that we have a predictable environment, that we are really making the cost of business very affordable so that these products can be produced in the most affordable way, and then we'll be able to compete in the global market. So innovators are there in Kenya.
Yeah.
Being able to commercialize those innovations will require all the support we can get, especially from our partners and government. The cost of credit also, because one of the things even for this team that has worked on the ventilator is they're saying we need financing now to be able to go to scale. So that affordable finance that is long-term and really tailored for innovation would really go a long way. And incentives for research and development and R&D. Even when we are prototyping and trying to test some of these products, being able to, if you need to import anything, do it duty-free, also developing our local value chains and raw materials to ensure that we are able to supply any of those that we require for to our manufacturing locally.
Yeah, Phyllis, I was reading an article where you were quoted as saying that as a nation, we have come to realize the importance of local content and industry. Homegrown solutions are key to sustaining the fight against coronavirus while cushioning the economy from the shocks arising out of the virus itself. You had an entire list that you wanted the government to sort of implement to cushion the manufacturing industry. What is pending right now? What have they not done that you wish should be fast-tracked?
This is a continuous journey. As I've said, for many years, we've been working and engaging with government on different things. So there are the things that we are trying to grapple with because of Corona, because of course Corona has also brought its unique challenges. We've seen also stifled demand in certain sectors. There's serious reduced liquidity in the market because of the issues of delayed payments. So one of the big priorities for the manufacturing sector is the repayment of VAT refunds, because this will really inject liquidity into the manufacturing sector. For the people who have been exporting and are owed these VAT refunds, this is something that is really urgent. I know that it's a commitment that has come from His Excellency, the President, and the supplementary budget was being approved in Parliament to enable this. but it's something we urgently need to ensure happens. The other one is also the payment of suppliers, because there are a number of SMEs especially who have supplied to government and whose payments are pending. So the payment of those amounts, I think, would also go a long way to cushion the SMEs during this season, who I believe are really hardest hit by this. The other one is also, as I said, the banking sector to come out to support business during this season. I know a number of banks have gone out and said that they are able to sit with their customers and renegotiate those loans. This is something that we also need to happen urgently, and also especially for SMEs, for government to urgently develop very affordable financing to enable them weather this storm. So a credit guarantee scheme that can back the money coming out of the banks, so that we really encourage the banks to support SMEs during this season. Another one is the issue around wage support, because certain sectors have had to lose out on their markets and are unable to either export, and there are big numbers of employees at stake. So people are having to either send people on unpaid leave, and some support towards that from government, I think, would be welcome. And then lastly, the implementation of all the measures that His Excellency the President had mentioned that formed part of the tax amendment bill would also go a long way in cushioning. But I think as we go through the crisis, we'll just keep evaluating and see what the needs are and engaging government on the same.
So the president had said that the suppliers should be paid by 3 weeks. You're saying they haven't been paid? Some of them have not been paid up until now?
What happened is some of the expenses had to be approved by Parliament, and as you know, Parliament just came in last week. So the supplementary budgets approvals and reallocations had to happen before the payments. I think we'll get that out of the way in the course of this week, and then we'll look to government to confirm and advise on how quickly they could pay the suppliers and also the VAT refunds.
Is there a plan to cushion the people who are saying that they are reeling out of the effects of the COVID-19? They don't have raw materials, they can't sell spare parts. What is the plan going forward?
For that, we are still engaging with government, because, of course, the measures that have to be put in place to limit the spread of corona have led to some industries having to scale down production because of the issues of social contact, now even the containment of movement. As far as possible, we've tried to ensure that the essential manufacturing continues, and in this government have been supportive to see that we ensure that goods are still moving and that factories that need to operate are operating even at night. And this has really supported those industries that can run at this time. But there are those industries that have really scaled down production if you look at certain sectors. And we also have counties that have said that industries should shut down, which is unfortunate. So going forward, what we would like is to see, as much as possible, how we can support essential manufacturing that needs to happen. And we are also working on a rebound and recovery strategy so that post-COVID, the manufacturing sector can quickly take off. But in the meantime, there is need for us and the policymakers to engage and see certain measures that can be in place, especially around wage support for critical sectors, and to ensure that we do not have people out without jobs, or without pay, because that would also lead to a lot of social issues in the society.
All right. Thanks, Phyllis.